everyone, and welcome to the Political Job Interview, where I interview candidates running for election. I'm Vincenzo Calla, the host, and today I take on the role as the boss, giving a job interview to today's candidate, Dr. Julia Riddell. Julia is running for election as the NDP candidate for the Winnipeg South Centre by-election. Thank you, Julia, for your time, and welcome to the Political Job Interview.
Thanks so much for having me.
So we're going to start off with the first segment, which is called About the Candidate, where we're going to talk a bit about who Julia is and her experiences and achievements so far. So first off, can you tell me a bit about yourself and your story?
Yeah, absolutely. So I guess going back a little bit, my maternal grandparents survived the Nazi occupation of Poland. My mom was born in Poland and she came over to Canada when she was about 6 years old. I grew up in a rural area and I spent a lot of my time being really curious about the natural area. I was one of those really nerdy kids who, at like 8 or 10 was walking around with a microscope and putting like pond samples underneath it and, nerding out about like protozoa and stuff like that. I did an undergraduate degree in psychology at McMaster University. And that's where I learned about peace studies. So I would have been probably 18 and started learning about, global peace and conflict studies, political science, Indigenous studies, and got really, really passionate about the idea of human rights. Started learning more about Canadian politics, international politics, and ended up finishing with a bachelor in neuroscience, psychology and behavior, and a minor in peace studies, and got pretty involved in doing grassroots activism in Hamilton, where I was living at the time. And then I went on and did a master's and a PhD in clinical developmental psychology, which set me up to be a clinical psychologist, which is what I do now. And my residency brought me to the University of Manitoba. And so after I finished that, I took a position as an assistant professor. I began working as a psychologist in the public healthcare system. And the COVID pandemic hit. And during that time, I ran as a candidate for the NDP in our 2021 general election. And I was nominated again for this by-election in Winnipeg South Centre, and then switched a little bit to doing some work for a not-for-profit private practice, outside of the public healthcare system.
So I want to talk a bit about this election now. So this election came up unexpectedly. Obviously the late Honorable Jim Carr passed away, unfortunately, and this by-election came up, like I said, unexpectedly. So why did you decide that you would run in this by-election, and why did you decide? Yeah, why did you decide this was the right time, and why are you running for the NDP, and why are you running at all?
Mm-hmm. So I think it goes back to agreeing that I would run in 2021 for the NDP. I was working basically, from 2020 to now, till January 2023. I was working as a psychologist in the public healthcare system. I saw how many people had just incredible difficulty accessing mental health treatment during the pandemic. So not being able to access, assessments. So children waiting up to 2 years for things like autism or learning disability assessments. I saw a lot of people trying to get access for therapy for things like PTSD or anxiety, and just waiting so long and getting worse and worse and worse. And I also know that if people have access to good treatment in a timely manner, they can get better. And so I saw not only in myself, but in my colleagues, people experiencing a lot of moral distress and feeling like there's so many people they want to help, but we didn't have the funding or the resources to do that. And then I also watched what was happening to seniors who were in for-profit long-term care homes. They had some of the highest rates of COVID-19 infection, as well as like the highest rates of death. And even in Canada, like our rates were much higher than other developed countries. And not only just with mental health and seniors care, but just our healthcare system in general. We have like really long wait times for surgeries. Nurses were mandated to work overtime, and people were really burning out. And health is something that, I mean, I care about a lot of things. At the end of the day, I care a lot about people. And I could not stand by and see our healthcare system in the state that it was in. And I couldn't stand by and see my colleagues suffering and struggling and wanting to help people. So I just felt like I had to make a difference. I had to do something. And so that's why I chose to run in 2021. And I was asked to run again. And to be honest, the reasons that I ran in 2021, things like homelessness and poverty and the environment and the healthcare system, they're just as bad, if not worse now. And so my reasons for running in this by-election are the same as in 2021.
So I want to talk a bit now about this job and what you're bringing to it. So what experience do you bring to the job, to the job of an MP? What would you bring to Parliament if you were to be elected as an MP?
Yeah, it's a really interesting question. I think I'm unusual in that I am a healthcare provider and a psychologist and a professor, as opposed to having a background in law, for example, or political science. And what I know a lot about is not only people, but also complex systems. And when I think about any of the challenges that are facing us today, whether it's, the federal government, provincial government, even municipalities, things like addictions, the opioid crisis, the housing crisis, the environment, all of these are really complex problems that have so many different pieces that all fit together in different ways. And these problems require complex solutions. And so I think that's something that I bring. I'm really, really good at working with people from all kinds of different backgrounds. I'm really good at thinking about very complicated things, but at a very practical level. Like, we've got a problem, people are suffering. What can we do to fix it and to help people? I'm a clinician scientist. I'm a practitioner. So I take all of that research and knowledge and I boil it down to like, what can we do in the here and now? And I think that's a different approach than people who maybe just study theory or who just have more of a background in academia or in law. I'm a clinician, so I sit with people when they're suffering, when they're struggling. I hear their stories, and I'm a really deep feeler. Like, I'm a people person. I care so deeply. I'm so passionate, and I'm also a scientist. So when I have a policy question, I do exactly what I do when I publish papers. I look at the data. I look at what the research tells us. I develop a hypothesis, like, okay, so why do we have such a housing crisis? Like, what is the heart of the issue? And then I look at, what's the data telling us? What have we done before here in Winnipeg, Manitoba, Canada? What are other countries doing? And so I think what experience I bring is, because I've done a PhD, I know how to learn about things that I don't know about. I know how to ask questions about really complex topics, things like human wellness. That's a really complicated topic, right? There's hundreds, actually thousands of years of thinking about these kinds of things. And I know how to integrate multiple perspectives. I don't believe that there's a right way, like one right way, or I'm not really ideological or fixed on one way of doing things. I think I'm really solution focused and data driven. And those are things that I want to see in politics. I want to see people asking, what works, how do we do it, as opposed to getting really stuck on, okay, well, this is what as conservatives we've always done, or this is what as liberals or NDP, and getting kind of stuck in those boxes. The other thing is I'm really passionate about figuring out if what we're doing works measuring the impact of our policies and figuring out if they're actually working and helping people. And I think because I've had experience doing that, that's something that that I bring to this position.
So I want to talk a bit about the candidacy now, your candidacy. So this is definitely one of the races I'm watching very closely because I feel like this is going to be very interesting to see how this one goes because it's not incredibly clear how it's going to go. I mean, that's with all elections, but I'm watching this one and I'm wondering what do you think sets yourself apart from the other candidates who are currently running for this job, the other candidates running for election in this riding?
Well, I'll give you the obvious answer first, and then we can go a little deeper. So, the obvious answer is that I'm a woman, and I'm the only woman running in terms of the other major parties. The other, like liberal, conservative, Green Party candidate, they're all men. And that might seem like, well, who cares about someone's gender? Like, why does that matter? I'm really, really interested in other leaders, like, for example, Jacinda Ardern, the Prime Minister of New Zealand. She's talked about what women sometimes bring to leadership roles, not only women, but folks who are non-binary, folks who have had different experiences of positionality, of privilege in our culture, and why diversity is so important in leadership roles. Some of the things that Jacinda Ardern talks about is how, again, it's traditionally female, but not only, how female leaders sometimes have a different leadership style. And the way that she describes that style really resonates with me. So she talks about that idea of really collaborative leadership. So bringing everyone to the table, being able to consult with multiple people instead of kind of saying like, well, it's my way or the highway, and this is the way we do things here. When I worked in the public healthcare system, I was part of a multidisciplinary consultation team. And so we sat around a table with psychiatry, with psychology, myself, with social work, with OT. We had people who were psychiatric nurses. And I just love that way of working with people who have different perspectives and different ways of knowing and different experiences. And I think what's unique about me is not only do I have direct experience working in sectors that we're fighting for and representing, but I have a different leadership style than at least I've seen in politics. I don't know the other candidates personally, so I can't say for sure. Maybe they lead like this as well. But compared to what I often see in politics, I would say that I'm much more open, collaborative, take a really team approach. And I know for sure that I don't know everything, and no one can know everything. And so my way of leading is to be really grounded in what I know and really grounded in what I don't know, and surround myself with people who know things that I don't know. So for example, like, I'm not an economist. I don't have a background in economics, but I do know how to talk to people and ask those questions and have them at the table so that we can work together on solutions that are going to work for all of us. And I think that's a very different style than what I've seen in for sure other candidates, but also other leaders.
I want to talk a bit now about the people. So you had mentioned how you're a people person and working with the people is the most important part of politics. And in Canada, and we have a great system, a parliamentary system with MPs that you directly serve your people inside the House of Commons. So I want to talk a bit about how you are going to serve these people that might elect you if you're elected. So first off, what is something locally, what is something that the people of Winnipeg South Centre need that you want to get done for them if elected, or what's something that you want to bring to the House of Commons for them?
I love that question. So for me, the number one thing is access to affordable, timely, and high quality evidence-based mental health care. So many people I have talked to just cannot access treatment. They can't access therapy. They wait so long, or they get partial treatment. So meaning, okay, you get 6 sessions, or, oh, you can have a group, but not individual treatment. I really believe that mental health, spiritual health, Emotional health, physical health are all part of wellness. They're all part of health. And I want to see our healthcare system take care of health in all ways. And so I would advocate extremely hard to have the closest thing to universal mental health care that we could get in my time in office. And that's something that I hear from I haven't yet to have one person say to me, I've canvassed almost every day since my nomination and canvassed every day during the election, except for one during 2021. And I've yet to have one person say to me, I don't agree with having better access to mental health care. So what that tells me is that's something that people in my riding want. That's something that they need. I think the other thing that I hear from people and that I feel very strongly about is making sure that we have clean water, clean air, trees, making sure that we're planting more trees than we're cutting down, which is not the case here right now. And so really putting strong environmental regulations in place, making sure we're prioritizing the environment over corporate profits. That's something else that I hear from the people that I'm speaking with and that I feel very passionately about as well. And I think that has not been the case, and is something that I would work tirelessly to advocate for.
Well, both very important issues. Mental health is an issue that I've been focusing on for a while because it's an issue very important to me. During this past mental health week a while ago, and I covered a mental health uh, funding here in Ontario, and it's just so important to look at all those aspects of mental health that you were mentioning before, and something that hopefully everybody can work together on to get done in the House of Commons and across all levels in government in Canada. And finally, now I wanted to ask you, what is one accomplishment that you have personally achieved that demonstrates why you would be a good elected official if the people of Winnipeg South Centre choose you as their MP?
My first inclination is to say, well, I did a PhD, so it means I can do things that are really hard and that make you want to quit, but you don't. But I actually think probably the thing that demonstrates why I would be a good MP would be when I worked in the public healthcare system, I spearheaded the implementation of outcome monitoring. So outcome monitoring is a way of measuring if what we're doing is actually working and sort of adjusting or changing it if we're not, so that it does start to be effective. It's something that we do to kind of track progress through therapy, but you could also use it for other things as well. So like for a therapist, for example, it's a way of seeing, is the type of treatment I'm delivering, is my client actually getting better? And if they're not getting less depressed or less anxious, then I got to change my approach. I got to do something differently. And so for me, the big achievement wasn't convincing my director, give me the funding to do this, because that was part of it. We had a very supportive director, and the money still has to come from somewhere. Or getting bragging rights to the other regions that, oh look, we got this first. I think the actual accomplishment was being able to talk directly with the people who the decision influenced. So I was a consulting clinical psychologist. There was me and only one other psychologist for the entire healthcare region. So it's about a fifth of a province. And so I was helping with the rollout, and I was also using the system. A lot of the other therapists, most of them were not psychologists, right? They were had backgrounds in social work, some of them were occupational therapists or psych nurses. And just like when we make a new change with anything, I think about politics all the time, right? When there's a new law, a new bill, a new public health intervention, there's a range of reactions to that. So some people are really super on board, some people are kind of hesitant or skeptical, and some people are outright against it. And that's exactly what the spread was in this program that I was running to get outcome monitoring. And so I'd say the real accomplishment for me was being really, really involved with the implementation, sitting around the table with them, um, doing it too, being involved with, okay, we're all doing this together, making sure that they were equal collaborators in the rollout, um, not having my set idea of like, well, you should be doing it this way and by this time, but really working with them, training them, problem solving, hearing them out when they were talking about when I was getting pushback, really trying to understand, okay, well, what was it about? Like, is it I'm nervous, I'm scared, I'm not good with computers, I'm just overwhelmed with because work in the healthcare system is a lot, and now you're adding this other thing. And so, like being really, really collaborative. I think that's a really good example of what I would be like as an MP, an elected official. That like I'm someone who's willing to come to the table and listen and really, really listen. I don't mean listen, but like have my mind made up already, but to truly listen to my constituents or to other MPs or anyone in that I'm meant to be working with. And someone who's willing to put the hours in and the work in and like really get down in the trenches with the people who need help and who I'm meant to be serving. And I really think of it as not that hierarchical, but that we're kind of in it together. So I don't know. I hope that answers your question.
Well, definitely, and very, very important. You mentioned, listening to the people, and that is the premise of the job. Listening to the people and bringing their voice through the lens of serving them and working with them. It's just so important and a great way to end on today. Thanks, Julia, for joining me. It was really great having you, and I'm sure the viewers have enjoyed hearing what you have to offer to them. So, anything else you want to mention before we end off for today?
Thank you so much for doing this. And I really hope anyone from Winnipeg South Centre does get out and vote on June 19th.
Well, yeah, like you mentioned, election day is June 19th. So if you liked hearing what Julie had to say and live in Winnipeg South Centre, you have the opportunity to vote for her on election day. Check with Elections Canada for more details. And if you don't live in Winnipeg South Centre, there are a few other by-elections that day. So make sure to go check across the country, Ontario, Quebec, and Winnipeg, so Manitoba. So make sure to go check with Elections Canada to see if you're eligible to vote on June 19th. So the political job interview is a VCalla production. Until the next video, I'm Vincenzo Calla, signing out.